Have you ever thought about starting your own podcast? When I was trying to get this podcast off of the ground, I had a lot of questions. How do I record an episode? How do I get my show into all the apps people like to listen? How do I make money from my podcast? The answer to every one of these questions is really simple. Anchor. So, if you always wanted to start a podcast, make money doing it, go to anchor.fm/start to join me and diverse community of podcasters already using Anchor. That's anchor.fm/start. I can't wait to hear your podcast. Thank you so much. See you soon.
Doctors are calling it kit under stress of the pandemic. Thousands of medical practices are closing as doctors and nurses decide to retire early off shift to less intense job. 2 years ago, Dr. Kelly McGregory opened her own pediatric practice just outside Minneapolis, where she could spend as much time as she wanted with a patient. Patients and parents could get all of their questions answered. But just as her practice was beginning to thrive, the coronavirus hit the United States and began spreading across the country. As an independent practice with no real connection to a big health system is what's awful, Dr. McGregory said. At one point, she had only 3 surgical masks left and worried that she could no longer safely treat patients. Families will also stay in a way concerned about catching the virus. I did some telemedicine, but it wasn't enough volume to replace what I was doing in the clinic, he said. After her husband found a new job in a different state, Dr. McGregory, 49, made a difficult decision to close her practice in August. It was devastating to she said. That was my baby. Many other doctors are also calling in kids. Thousands of medical practices have closed during pandemic according to a July survey of 3,500 doctors by the Physician Foundation, a non-profit group. About 8% of the doctors reported closing their office in a recent month, with the foundation estimated could equal some 16,000 practices. Another 4% say they plan to shutter within next year. Other doctors and nurses are retiring early or leaving their jobs. Some worry about their health because of age or a medical condition that puts them at high risk. Others stopped practicing during the worst of the outbreaks and don't have energy to start again. Some simply need a break from the toll that the pandemic has taken among their ranks and their patients. Another analysis from the Larry A. Green Center with the Primary Care Collaborative, a non-profit group, found similar patterns. Nearly a fifth of primary care clinicians surveyed in September say someone in their practice plans to retire early or has already retired because of COVID-19, and 15% say some have left some plans to leave the practice. The clinicians also painted a grim picture of their life as the pandemic entered a new robust phase with the record case count in the United States. About half already said their mental exhaustion was an all-time high. Many worried about keeping their doors open. About 7% said they were not sure they could remain open past December without financial help. For some, family obligation left them no choice. Honestly, if I'd had a bit of the pandemic, I would have still been working because I was not my plan to retire at that point, said Dr. Joan Benka, 65, who worked as an anesthesiologist in Madison, Wisconsin. But her daughter and son-in-law hold administrative position in a hospital intensive care unit, treating the sick COVID patient, and they have two small children. When case Cleveland in the spring, their care center closed and their Benka daughter desperately needed someone she trusted to look after the children. It wasn't the way I wanted to end my career, Dr. Benka said. I think for most of us, we would say you would fall on your sword for your family, but not for your job, she said, adding that the no other female colleagues who have stayed home to care for children or other relatives. Dr. Michael Peck, 66, an anesthesiologist in Rockville, MD, decided to leave after working in April in the hospital intensive care unit, intubating critically ill patients and worrying about his of health. When the days was over, I just said, I think I'm done. I want to live my life and I don't want to get ill, said Dr. Peck, who had already been cutting back his hours. He is now spending a few hours days as chief of medical office for a startup. Still more practices have proved resilient. The Paycheck Protection Program authorized by Congress to help businesses, including medical practices, with the economic fallout of the pandemic, helping many doctors remain afloat. That money cannot have made a solid, said Dr. Ripley Hollister, a family physician in Colorado Springs who serves as chairman of the research committee for the Physician Foundation. The volume now is really coming back, he said. But depending on the future course of the pandemic, Dr. Lisa Bielomokis, co-founder of Yes Healthcare, a consulting firm, predicts another wave of financial strain hitting practice. Many doctors group will seek a buyer, with her and a hospital, an insurance company, or private equity firm that plans to roll up practice into a large business. One doctor who asked not be identified because the discussions are confidential say he and her partner had already been talking with the nearby hospital nearby about buying their pediatric practice before the pandemic arrived in the United States. Although federal aid has helped patient visits are still 15% below normal, she said, and they are continually worried about making payroll and having enough doctor staff to see patients, and the number of virus cases balloons in the Midwest. Her employees must deal increasingly agitated parents. They are yelling and causing at my staff. She said, working of a telemedicine firm amid the alternative, she added, is a hard to be beat with your own business, she said. The coronavirus crisis has amplified problems that doctors were already facing, whether they on their practice or are employed. A lot of physicians were hanging on by thread from burnout before the pandemic even started, say Dr. Susan Bailey, the president of the American Medical Association. In particular, smaller practices continue to have a difficulty finding sufficient personal protective equipment like gloves and masks. The big hospital and healthcare systems have a pretty well established systems of PPE, she said, but smaller offices may not have a reliable source. I was literally on eBay looking for masks, she said. The cost of these supplies has also become a significant financial issue for some practice. Doctors are also stressed by the never-ending need to keep safe. There is a hunker down mentality now, Dr. Bailey said she is concerned that some doctors will develop PTSD from the chronic stress of charging for patients during the pandemic. Even those who are not responsible for running their own practice are living. Courtney Berry, 40, and a family nurse practitioner at a rural health clinic in Soledad, California, watched the case of a coronavirus finally up in her area only to see wildfires break out. Many of other patients are farm workers and work outside, and they became ill from the smoke. In 14 years in arts, Mr. Berry have never experienced anything like this that is just such a high level of stress and just keep it going, she said, adding, the other hard part in there is no end in sight. She tried working fever-based but decided eventually that she would stop altogether for several months, beginning in early December. Mr. Berry hasn't figured out what's next for her. My intention is to stay in medicine, although it would not to be totally opposed to doing something in a totally different area, which is something that I would not have said in the past, she said, and a patient have indeed felt in effect the pandemic had developed into a really hot destruction, said Hollister, or Dr. Hollister, the family physician who think closer practice are likely to result in a significant impairment to the patient's access to medical care in his community, where both specialists and primary care doctors are living. He is tending to more patients who no longer have a doctor. It is an issue that Dr. Matt Gregory, who took a job on the University of Wisconsin School of Medicine and Public Health in Madison, worried about. There were some families in her practice whom she could not convince to find another pediatrician. Immediately, she said that